Government got a grip on this virus?
Got a grip on this?
Ministers racing in for an emergency meeting on coronavirus. 4 more cases confirmed, 1 a school child. 40 people in the UK now have the disease. The government on high alert and people have questions.
Mr Williams, should schools shut down, Mr Williamson? Should schools shut down, Mr Williamson? Mr Eustace, can we contain the virus? Are we moving to delay phase? Can we contain the virus? Have you got a message for the public, Minister? Have you got any advice for the public?
Wash your hands, yes.
I know you can't talk about what happened in Cobra, but we can't really contain this virus any longer, can we, sir?
Look, I think you should direct questions to the Health Secretary, not to me.
But that question today answered by the PM himself.
This is a problem that I think is likely to become more significant for this country in the course of the next days and weeks, and therefore that we've been making every possible preparation for that. If and when it starts to spread, as I'm afraid it looks likely that it will, we are in a position to take the steps that will be necessary.
All nations in the UK now preparing for the situation to escalate in the coming days.
The next phase of this would be what's called the delay phase, and that phase starts when it is judged by the experts that the infection has taken hold within the community, and what the purpose of the delay phase then is to slow down the spread of the infection and to lower the peak of infection.
The Shadow Health Secretary thinks the government should give the NHS an emergency cash injection to help it cope.
I do have fundamental concerns about the capacity of the NHS going forward. We know that critical care beds were at 80% occupancy last week. We all know that the NHS is under huge pressure after 10 years of cutbacks and austerity. We know it hasn't got enough staff.
The government's officially in the contain phase, trying still to stop the spread of the disease. But officials privately admit to me that they can't contain it for much longer. So what comes next? Well, they'll move to the delay phase, trying to slow the spread of the disease in order to buy time for research and limit the impact on the NHS. For now, there are no mass school closures, cancelling of sport events or city lockdowns, but all of that could come as the government grapples to contain a global epidemic.
This former minister and practising GP worked on pandemic planning when in government.
Yes, there will be a series of stages. Yes, you could see school closures. Yes, you could see football stadia being empty. All of those things are possible, which is, I suspect, why the ministers responsible are probably having sleepless nights.
Ministers planning for the worst. Hopefully it won't come to that. Their action plan will be published tomorrow to coincide with a public information campaign. A disease that began thousands of miles away, now impacting all of our lives. Beth Rigby, Sky News, Westminster.